Good evening, ladies and gentlemen. I'd like to welcome you to our free webinar and Ayurveda approach to boost your fertility, organized by Nuffield Academy. Tonight, we have the privilege of having our esteemed guest speaker, Dr. Varsha Santhosh, to share her wisdom and insights on this topic. Dr. Varsha is a qualified Ayurvedic physician from India's Pune University and has practiced in Singapore for 8 years. And without further ado, Dr. Varsha, please.
Thank you, Ken. Good evening, ladies and gentlemen. Before we begin our journey into this topic of boosting fertility with an Ayurveda approach, let's invoke the blessings of the Lord of Ayurveda with a short mantra. Om Shri Dhanvantaraye Namaha. May the words that flow out of this mouth be scientific and be with Shastra. Shastra, that's what Ayurveda is, where the words cannot be proved wrong in all the 3 time zones, past, present, or future. Science, one, it's constantly developing. So maybe we can just fuse both of this in today's talk to get an idea what it is, and then enter into the Ayurveda aspect. It's always a matter of concern for the young couples if they are not successful in begetting a child. Or sometimes it's the other way around as well, that you're not able to perform. So we're going to see all these aspects and we'll see how to boost fertility. I'll begin my short presentation. So this evening, when we go with the Ayurveda approach, before we see the solution, we need to know what is that we are looking for. What are these structures over there? What could be the possibility where something could go wrong rather? And then it's easy to repair. So to identify a problem first is important. For that, we need to know what is a normal aspect of it. And once we know how the normal functioning is, when a problem occurs, we're able to identify, then the solution is valid. The Ayurveda concept starts on a very subtle aspect. To know the subtlety, we must know what is gross. The modern science is based on the grosser aspects. So we'll take our initial help with the modern aspects, get into the subject, understand what is at the gross level, and then we go for the subtle aspects and to the solutions. So let's begin our journey today. When we say we want to boost fertility, what are we trying exactly to boost? So what is fertility? It's a natural capacity to conceive or induce conception and produce an offspring. To make someone pregnant or to get pregnant and to retain that pregnancy and deliver a healthy baby. So sometimes some people can conceive, but they cannot hold the pregnancy. It might get aborted. So if it's getting aborted before 20 weeks of gestation, we call it miscarriage or a stillbirth. And this is common. And that so many women see it as a pattern that they can't retain. So again, that also we take it under the subfertility or those people who are qualifying to get the fertility boost. So we should have it naturally. Sometimes when it's not there naturally, then you need some assistance. Sometimes some small herbs would be okay, but otherwise sometimes there are some hormonal modern medications or some surgical advances also in the later stage. Let's enter the subject directly now. So we'll see first the aspect of what's in the male reproductive system. How does it happen? So in the testes, where the cells are formed, the spermatogenesis happen with a hormone called as testosterone. then it is passing out through the epididymis to the vas deferens into the seminal vesicle, coming through the prostrate gland. Right in the center there is a tube, and for a male person, the urinary tract and the discharges, the seminal discharges, are going through the same tract. So first we should understand how the structure is and how it is forming. So there are basically 3 hormones. One is secreted in the testicles itself, and 2 are secreted in the brain from the pituitary gland. So this, we need not get into the names, but we just need to know how it is formed and what is the process, so that when the problem occurs, we can identify where is the problem, whether it is in the tube, whether it is in the hormone, whether it is in the way the sperms are created, or whether it is the way, whether there's an erectile dysfunction. So we'll see them one by one. So there could be at different levels. So when we see a normal structure, so what the possibilities are there, that there could be a problem in the sperm production itself, or as the sperm is getting, it's passing, there could be a problem in the blockage of the transport, or there could be some sexual issue, like let's say the failure of ejaculation could be there, or ED, erectile dysfunction could be there, or there could be some hormonal problems, that whether there is either something from the pituitary gland problem or something from the testosterone. Then there is sperm antibodies. So that means the body is not having or reacting adversely to the things that are getting formed. So we'll just keep it at a very gross level initially. But if we know the structures, then each of the structures can lead to each of these obstacles why infertility should happen. Let's see the female aspect. So we are going very briefly into it so that we can spend some time on the solution aspects of it. Okay. So again, so the ovaries would release the egg, which would pass through the fallopian tubes. So in between, they will be meeting with the sperm, then it will come and embed on the uterine wall. But if they don't meet with the sperm over there, then it will be excreted as a menstrual blood along with the uterine linings that have been formed. So this is a normal passage and the normal way why a menstrual cycle would happen or why it would not happen. Again, so when we know what are the structures over there, same thing, there would be the problems of those levels. So there could be a problem at the ovarian level, there could be a problem at the tubal level, there could be a problem at the uterus level or at the cervix level. So once we know what is the structure, what is the mechanism happening, like if you have seen how the machines in the factory work, those who are technicians, they know what is exactly, and then they identify the problem accordingly and they rectify. So this is a God-made super, I should say, advanced machine where the parts you can replace these days, but not everything is replaceable. And there is certain natural formation. So it's something very God's marvel or wonder, which I always feel astonished and amazed with. So at the moment, we keep it at this, that these could be the 4 areas of the problem that we can face. Let's go ahead. Why would there be a possibility of not getting pregnant? Or when we would call that a person is infertile? It's not immediately. So at least a person is trying unprotected sex for about a year or so, and a person doesn't succeed, then we classify them that they are needing help to boost their fertility. So it's an infertile case we would be calling that. So there will be again underlying so many problems from, as we said, it could be at the organ level, it could be at the hormonal level. There could be several areas, and it could be problem in one person, or it could be in both the partners. We'll have to identify each of this by a proper examination. What would be a generalized risk factor why a person is not sufficiently fertile? So the predominant factor what we see these days, it's the age. Everybody is career oriented. So gone are the days when the marriages were done at a younger age. So now earlier it was even 18, now it has been raised to 21 years in India. And then the career shapes, you are not just happy with your graduation, we need a post-graduation. And if somebody is planning to be a doctor, then it's like till 25, 27 years, you keep on studying, then only a graduation is not enough. You need a post-graduation specialist. Then, yes, so our college days have been extended and hence the marriage years have been extended. You don't want to get married as soon as you finish your education. You say you want to get settled or you want to earn enough. And there is always this insecurity going on in the mind, whether I'll have a job or not, whether I'm earning enough to sustain a family or not, or probably it's like you have a target, a goal that you want to be some manager, some CEO, you want to have your own identity and make a mark. So both males and females delay to get married. And that's one of a major concern and a basic and the first concern why the infertility rate is higher these days. Second is diabetes, the underlying cause, very common cause again. Third is this eating disorder. Fourth, alcohol use. So what is excessive alcohol use? There are people who argue, no, I don't drink every day. It's just on a weekend. Yeah, just on a weekend is also too much to drink. So alcohol does lead to infertility. Exposure to environmental toxins, lead, pesticides, or whatever. Over-exercising, yes. So now you have got this loop training and intense training. So high intensity workouts. So all these over-exercising also can reduce your fertility. Radiation therapy, unfortunately, many people now these days we have cancer of various lesions and they undergo some cancer treatments that can reduce their fertility. Commonly seen as a sexually transmitted disease, that a separate talk we can hold on that. And Ayurveda has addressed this, yes, 5,000 years ago also, mention of sexual transmitted diseases there. Smoking, like alcohol, yes. Stress, substance abuse is there. And of course, the weight issues, both ways, having a lot of weight and having underweight also. What's not mentioned in this, probably I've mentioned it elsewhere, is we use laptops. So especially for the males, if they are creating more heat at the groin level, then that could be another reason for having a lesser fertility rate. Now let's identify more specifically. So whatever we saw so far was common to both male and female. Now we see specifically the risk factors, what in the female aspects we can see. So these factors which contribute would be, again, abnormal menstruation. This is a very common thing I've seen. Like these days, either the girls are having early menarche, like at 9 and 10, or when they start, they don't have a regular cycle and they are least bothered to even sometimes rectify it. Or sometimes the use of, let's say, contraceptives that they use, sometimes that's hindering the normal flow menstrual cycle, and especially if the middle-aged ones are using IUI, the intrauterine IUD device. It's going to be a complicated scene in a later terms. Blocked fallopian tubes. Then there are some diseases like celiac kidney disease. There could be a past ectopic pregnancy. That means the Instead of getting it embedded in the uterus, let's say it's getting embedded in the fallopian tube or elsewhere, but not where it should be getting embedded, then that's a problem. Then pituitary gland disorders, then common seen as a polycystic ovarian disease, sickle cell anemia, uterine problems, thyroid disease. So these are some of the very common risk factors. Then let's see what are the male risk factors. So varicocele is another common factor that's seen. A small surgery helps to solve this problem. Then genetic disorders, there can be high heat exposure. It's not just the tight clothing, frequent use of hot tubs or saunas, but even keeping a laptop on the lap and use. Injury to the scrotum or the testicles, sperm count if it is low or having low male hormones, misuse of some steroids, premature ejaculation or retrograde ejaculation also would be there. The semen flows backwards back into the bladder. Some cancer treatments over here as well. And sometimes the testes have not descended itself. So these are just the broad outlines that I have just mentioned very randomly. And solutions also I'm going to mention very randomly. Sometimes, like when you approach a doctor or a modern doctor, you can get initially some medications and that should be enough to boost your fertility. Sometimes a surgery like in a varicocele, or let's say it's a blocked fallopian tube. Or there are some advanced techniques also these days available, like assisted reproductive technology, we call ART, the art, like IUI, where you have it inseminated artificially. Then IVF, we have in vitro fertilization, that you derive the egg outside and then you match it with a sperm, fertilize it, and then again place it back into it. Then we have got ICSI. Again, the method is same, but instead of allowing the sperm to enter, you actually do it physically, you fertilize it. Or there could be a third party assisted reproduction, like getting donor egg or a donor sperm, sorry for that spelling error over there, and donor embryos, or even surrogacy, that you hire somebody to become pregnant for you. So all these factors, there are solutions, so there is nothing to worry. But sometimes it gets very taxing. So that's the time where I would say where Ayurveda can play some role, where it doesn't get so invasive, so taxing, or sometimes it just exhausts you. And because the success rate is not so very instant, so many of them have to repeatedly undergo, and that itself lowers the confidence of the couple. And then the act of making love also becomes so very mechanical, because you are just doing a procedure. So there are so many factors that plays on the mind. So how do we really can prevent infertility? Of course, there is the most thing which I have to say is that eating a balanced diet and maintaining a healthy weight. And when we talk about this, I think I'll take this up again later towards the end of the Ayurveda discussion. What would be a balanced diet? Because the view with the modern diet and the view with the Ayurveda, it's going to be very different. So we'll see one aspect of the diet today, specifically regarding to the fertility. Then yes, of course, not to smoke, not to drink excessively. If there are any underlying diseases, it's better to get it treated. Pay attention for any STDs, the sexually transmitted diseases. Limiting exposure to the toxins and staying physically active is not overdoing exercises. So there are some health freaks who do the exercise in the name of exercise. It's usually the overdoing of the exercise. Now let's get into the Ayurvedic aspect. So it was a very brief introduction of the gross aspect of what we are going to See, in Ayurveda, the beauty is 5,000 years ago, they've put it all so very poetically. I might quote few verses in between here and there, not because to show how that I know, but it is just to show how the beauty of Sanskrit, like a medical science, can be done in a poetic way. So we'll see that in a while. In Ayurveda perspective, when we are seeing with the fertility aspect, it's exactly like how we want to nourish a plant. What do? We see that the ground is fertile, right? The soil is a fertile. The seed is a viable seed. You are giving enough nutrition for it, correct? And the right season for it. So all these factors contribute growing of a plant or nourishing of a plant. Even if we are into farming, it's not that any seed can be planted anytime. You wait for a right season. So Ayurveda labels this as Ritu, Kshetra, Ambu, and Bija, the fourfold aspects. Ritu means a perfect season. Kshetra, that is a toiled, fertile land. Ambu is a great nutrition, a proper nutrition. And Bija is a healthy, viable seed. So these four factors, they constitute how a person's fertility is going to be. If all these are just perfect, it's a great fertility. Something going wrong here and there, we have some issues we need to rectify at those levels. So keeping a plant in mind or keeping a farming or in mind, it's the same aspect that we have to see in the Ayurvedic perspective. Let's go now in a very, very different zone. We saw like the menstrual cycle aspect of the women and how it should be regular. And we all know that, okay, it's a 28-day cycle or a 28 to 32-day cycle. But in Ayurveda, they have very detailed explanations about all the disorders of the female reproductive system into 20 aspects. They call it as Yoni Vyapat. So Yoni, we can take it just as female reproductive system, and Vyapat is problem. And there are 20 of them, of which today I'm just going to show probably 2 or 3 aspects of it, just to give you a feel of what is the thought process where Ayurveda view is completely different from the modern view. So modern is doing at a gross level fantastic. So it is unbeaten, unchallenged. But on the subtle aspect, we'll see the first one. First one is like, just for an example, we are calling it as a Vata type. Now, in Ayurveda, the basic components in the body are divided into 3 aspects called as Vata, Pitta, and Kapha. And anything that you do revolve around these 3 energy levels, I should say. In Ayurveda, it is called as a dosha. Dosha, you can loosely translate it as those factors on whom the health is completely dependent. If they are in balance, you are healthy. Otherwise, you invite disease. So, Vata, Pitta, Kapha, do you see them? No, you don't see them. You analyze them from their qualities, from the functions. So I'll just say briefly before we see the Yoni Vyapat aspect of it, like anything to do with the movement in the body and something that is having coldness, roughness, or coarseness in body is Vata. So we can loosely translate it as wind, but that's not going to be only aspect of it. So if my eyelids are moving as I speak, or even my speech, or the thought that comes, which expresses out as a speech, or as I talk, probably my hand was moving at the moment, or the head or the body, any movement, the breath is happening simultaneously, blood is flowing, food is getting digested, excretion, whatever is a movement in the body, it is controlled by this particular energy called as Vata. Then comes the Pitta aspect. It is denoted by the heat in the body, and it controls all the metabolism. All that is going to get digested. The fire in the body is Pitta. And then comes the Kapha aspect. It is heavy in nature. It is slimy, sticky, and anything to do with lubrication in the body is the Kapha aspect of it. All of us have this Vata, Pitta, Kapha in us, but each one of us is unique because we have it in different permutations and combinations. But everybody has it. Then comes this Vata, Pitta, Kapha. We don't see them, but the functions are there in the whole body. Their qualities are expressed, and from that we analyze. And each of them has a root place. So this Vata lives below the umbilicus predominantly. Pitta lives between the umbilicus and the chest predominantly. And Kapha's root place is above the chest in the head region. So it's Kapha, middle Pitta, and the end is Vata. Why this knowledge is important? Because this would be the base of what Ayurveda is going to say. And from where this Vata Pitta has come? So this has come from the nature, from the universe. Our sense organs, they are the ones which run out in the universe, and they bring that information back to us. Like probably now y'all are seeing me. So your eyes have gone out and got the visuals for you. At the same time, simultaneously, the ears are hearing me speak. So your ears are getting the sound information. So like that, we have got 5 sense organs which go out in the universe and bring out the information. If I'm eating something, the taste, the touch, and the smell. So these 5. So that means in the universe, there are only 5 things that we need to know. And those form the basic elements. The sound, which represents the akasha, which is loosely translated as ether or the space. The touch, which is coming from vayu, which can again loosely translate as wind, the touch aspect. The fire, the Agni Mahabhut, which is for the form or the shape, or the light. That's the eyes, associated with the eyes. That's the fire element. The taste is associated with the water element, and the nose is associated with the smell element, which is a earth element, Prithvi Mahabhut. So apart from these 5 elements, there's nothing else that we have to know out in the world. And these are the basic structure of anything that's forming in this universe. So this Akash and Vayu, that is that space, and the wind, that is the sound and the touch, they form the Vata dosha in the body. Then the fire element, the Agni Mahabhut and the Jala, it forms the Pitta type in the body. And again, the water and the earth element, it forms the Kapha. So earth is the grossest, and the wind and the ether are the subtlest form. So from this, we will now get an idea how it is related to this infertility topic, because the example I've stated over here is the Vata type. So in this, what happens is, if the woman is having a very high Vata in the body, and it's affected her menstrual cycle, and it could be for different reasons. Probably she's having a Vata aggravating lifestyle, Vata aggravating food. So when this is affecting her menstrual cycle will be probably having some pain or stiffness. There could be some numbness. There could be other associated disorders. And the secretions that she would be discharging would be like a very thin. The color won't be good. There would be pain, and it would be not so very healthy discharge. So this is a Vata affected menstrual cycle. So this is just give you one, excuse me, one feel of how what is happening in the universe, it's translated in the body, and how our activities are responsible for whatever our sufferings are. So like somebody is experiencing severe menstrual cramping, then that's not a normal thing. So that's we would say it's a Vata type of a problem, and she would need help in solving that. Let's go ahead a little bit. The Pitta type of a problem. So now we know Pitta is associated with fire. So how this problem would arise? It would be due to the excessive use of pungent. Pungent is like a spicy food. A lot of chilies are used. A red chili, green chili. Some can't do without spices. Or too much sour food, too much of lemon in everything. Or salty food, too much of chips, papad, packaged food, something which has got a shelf life, pickles, alkaline substances. So somebody who is indulging into this, it's not for one day. That's the lifestyle. If that's the pattern, then the pitta gets vitiated. And if that is going to get affected and interfere into the menstrual cycle, then there will be a burning sensation, there will be inflammation, there will be a lot of heat from the body. And as if a person will feel, oh, are you having fever? If they touch the body, they would ask, because it's a very high pitta aspect. And then the menstrual blood that would flow would be not actually a bright red color, but it would be having a dark maroonish color, sometimes blue yellow also. And it would also again expel with a lot of heat, and very foul smelling blood would be there. And I'll just say one more example. Example 3, like, because you've heard this 3 names, Vata, Pitta, Kapha. In a Kapha type, if a person is having Kapha aggravating substances, or lifestyle is more of, eating too much of sweets and all, then the discharge would be very cold, slimy, sticky. There would be itchiness. It would be so sluggish and very difficult to come out. There would be a mild to moderate pain. And she becomes very pale in this condition. So why all this has been said? So like this, I've just explained only 3 out of the 20 conditions. And each of them, they are very beautifully, and it would be beyond the scope of today's talk, because we need to know just the solution aspect. But unless we know the Ayurveda perspective and the depth in which they are dealing, because you will not probably hear any doctor asking you, what color is your menstrual blood? How is it? How is the consistency of it? Nobody asks all this, right? But when you come to an Ayurveda doctor, these are the things. Apart from when it starts, when it ends, the most crucial aspect comes this, because we'll have to put it somewhere in the category of where is the problem. We'll have to identify what is vitiated in the body, and that person's nature, the Prakriti, what is that Vikruti, what is the problem, and then the solution would be. So there won't be any standard solution. It would be tailor-made. So you wouldn't have same medicine for each person, because the symptoms would be in different permutations and combinations. This was just a glimpse for you to get a feel. Over here, there is one, I've just given some Sanskrit quotings over there to show that how poetically it is being said. And it says that, okay, now there are 20 female such gynecological disorders have been said over here. And it is because they affect the uterus. Sometimes they wouldn't be able to hold the sperm, or sometimes a woman will find it difficult to conceive, and she will suffer from other aspects, something called as gulma, which can be loosely translated as a tumor, heavy bleeding, or there could be various symptoms that she would be showing. So this was just one of the aspect of it. Now, in the same lines, the abnormalities of semen are also being explained, like how we saw the menstrual flow at abnormality. Likewise, so in Ayurveda, they have mentioned about 8 such abnormalities in the semen. Like if it is a frothy, it is called frenulum or tanu. It's not thick and good enough. It's very thin. It's very arid. Vivarna, that is, it's very discolored. It is having a very putrid smell, and it's slimy. It's abnormally slimy. It's afflicted with other dhatus, probably some blood or something else is coming along with it. So these are 8 disorders in the semen according to Ayurveda. Again, these 8 disorders are poetically listed in beautiful Sanskrit language. I've just put it across with some English meaning into the Sanskrit words over there. Now we see how they have classified these 8. So amongst this 8, that frothy, slender, the tanu, the thin, arid, scanty, discomforting ejaculation, that is due to the vata dominance, it says. So if the semen is affected like this, of vata predominant, then it's not having the capability to fertilize. If the semen is of like a bluish or a yellow discoloration, the putrid odor is there, or the ejaculation is with a burning sensation, then we say it is affected by a pitta aspect. And when a semen is affected by kapha, it is extremely slimy and it obstructs the channel. So these are just, why to know this is the thought process of the rishis 5,000 years ago. They have said all these things in details. Isn't that itself like a great wonder, I sometimes feel. So these 8 types of semen disorder, it's due to, we call it as there are something that holds the body, we call it as dhatu. I'll talk about it later. So this is the last dhatu, which is a strongest dhatu it should be. But because it is vitiated by vata or pitta, there it creates a problem either to the individual or it's affecting the fertility. So to have a good progeny also, it is going to get affected. So why children get into so many problems, why there, so it's all how the seed is. Like you always think of a plant, if the seed is healthy, the plant is going to be healthy. But if the fault is in the seed itself, how will the plant grow well? We go ahead now. Over here. So now, if we have seen the abnormal aspect, what is the normal aspect? What is a healthy semen sign? So again, the Sanskrit verses are there. Maybe I should, just for an example, chant it so that you get a feel of how in the Ayurveda texts about 5,000 years ago it's written, Snigdham ghanam pichilam cha madhuram cha vidhahi cha reta shuddham vijnanat spatika sannibham. So it is snigdha. That means it is very unctuous in nature. Ghana is, it's very viscous in nature. Pichila, slimy. Madhura, sweet. Avidahi, it's non-blazing. And looking like a white crystal. And these are all the signs of a normal semen. I was little diverted. One joke in the classroom, like we were all teenagers when we were doing Ayurveda back 35 years ago, 31 years ago. And so like this, so we always had some jokes and also within ourselves. Just remembered one of my college joke about this, that the Ayurveda Acharya, the teacher, is teaching like this in the class, the sign of a healthy semen, and he's going snigdam ghanam madhuram. Madhuram is translated as a sweet. Then suddenly one girl spurts up, no, it's not sweet. So there was a pin drop silence. And then she realized what it was, and there was a burst of laughter that what it meant. So those days, all these were like little funny things, but probably these days it's not for 17 and 18. And so I'm talking about 30 years ago. Now let's see how to manage principles of how to, what Ayurveda is saying, what we should do to manage this. Okay, so in case like these diseases, we do some aphrodisiac treatments, herbs that should be more than sufficient most of the times. But sometimes that's not sufficient. Then you have to give some formulations which are pacifying the pitta aspect of the body. Then there are some times, or not sometimes, mostly all the infertile cases, or even if the person is not infertile and want to boost the fertility, Ayurveda's forte or the USP is the ghee is given, and it's not just an ordinary ghee. There are different range of medicated ghee, and Ayurveda insists on that. And I've seen very good results when a person is put on the certain, depending upon that person's nature, after analyzing which kind of ghee we should give. So right now over here we see this example, right? A Jeevaniya Ghritam over here. So one of the ghee is there. Of course, this Shilajit and Chawanprash, every other thing is there. But the ghee aspect, we'll talk about it when we are talking, as we are progressing our talk. Ghee, milk, which people don't like now, but these are best nourishments to have a very good health, delay aging process, have not just a good memory and a good long life, but one's fertility is at highest when one indulges in drinking milk and ghee. Today, it's not the scope of having how to do the treatment for a pregnant woman. So we have got a month-wise what medicine we should give for the first month, second month. And in that, various kinds of ghee is one of the predominant. Not just the cow ghee. The cow ghee is treated with certain herbs and given. Then for the semens that are affected with vata, over here now we get this new word over here, niruha basti with anuvasan. So now here comes is another USP of Ayurveda called as Panchakarma. You must have heard the word, but not knowing what exactly it is. So it's a five-fold therapy, basically. In the five-fold therapy, one of this, like you give medicine through the oral route and you bring it out through the oral route by emesis, that is one. So that's given for kapha, because we know kapha is now in, the chest above region. So if it's too much of kapha affected diseases, you induce vamana, that is called as emesis. Then you give medicine through the oral route, but bring it out through the anal route, like a laxative effect. So that is on the middle of your body. That's your pitta aspect. So we call it as virechana. Then there is another way of administering the medicine is through the anal route or through the vaginal route, urethral route. We call it vasti. So if you do it through the vaginal route, we call it as yoni vasti. Otherwise, it's just a vasti or a basti. So the medicine is administered like an enema aspect, but when we say enema, we think it's to clear the stomach. So normally I don't like to translate the word vasti or a basti as an enema, but for us to imagine what it is. So the medicine is administered through the anal route and brought out through the anal route. So we know now below the umbilicus is the vata. So anything to do with the vayu, excessive vayu, aggravated vayu, to balance it, we administer medicine through that to bring out the excessive vayu. So one such aspect is this Niruha Basti and Anuvasan Basti, where you inject certain kind of, let's say, oil, certain way it is mixed with some herbs, or you make decoction and of with different herbs and some amount of oil, ghee, honey, and the way we prepare the vasti is again it's like one very big ritual to make the content of this vasti to be delivered through the anal route, and that forms a major treatment part in Ayurveda to treat or to boost fertility. So first we had heard the major part is through the lifestyle. Then we heard, oh, the major part is through the ghee intake. And now we are getting deeper. The major part of the treatment comes through the Panchakarma aspect. And in that Panchakarma aspect, the Basti is the key thing because it controls the Vayu. And we know Vayu is now he's a ruler of the whole body. All the movements in the body is governed by Vayu. Whether your hormones have to secrete correctly, whether your glands have to function correctly, whether the flow of the menstrual cycle or the flow of the semen has to be correctly, all the movement is Vayu, and hence Vasti is a clear-cut major treatment of the Panchakarma aspect in the fertility boosting treatment. Then we have the semen disorders, like, see, you have got one more formulation over there written, Abhayamalekyam is given over there. But let's not get into the names over there because it will just complicate you. You need to see a very good Ayurveda physician to get first diagnose what is the dosha affected and then treat or boost your fertility accordingly. Then there are semen disorders by kapha. Pipali is something like a piper longum. It's not black pepper, but it looks something like that, but it is in an elongated way. Guruchi is our this Tinospora cordifolia. Loha is the iron. Triphala, most of us know now, and Bhalata Krasign. And when semen is affected with other dhatus, let's say like if there is a reddish tinge coming with the semen, if blood is coming, so it should be observed clearly by the Ayurveda doctor, identify which dosha is getting affected and accordingly give medicine. We go ahead. Again, Ayurveda says 4 things over here. Why there would be Clybia. Clybia is why there would be impotency. So the Ayurveda, again, I'm not getting to because of lack of time into the poetic aspect of it, which I truly enjoy chanting the Sanskrit verses. The 4 types which Ayurveda says in Sanskrit is the Bijupaghata, means there would be something defect hereditary or some congenital defect would be there. Dvajopaghata is erectile dysfunction. See, Ayurveda has told us 5,000 years ago. Jara, that's their old age. And Shukra Samtraya means it's a diminished semen. So these are the 4 reasons why a man would not have a very good fertile region. So what would be the symptoms? So a person desiring of the sex is unable to complete the intercourse because of loss of erection. And even if he tries to, there is so much of exhaustion, there is so much of perspiration, and all the efforts are very futile because the organ doesn't support, or also it is devoid of semen. So this would be a common first symptom, which exactly how in the Ayurveda book it is said. So it is not my words. It's the book of, it's the words of the Granthakaras. It's the words of the Shastras. Then we saw the 4 aspects, correct? So Dvajopaghata. So now the specific cause of that is being said over here. Like if a man is taking constantly a very cold food, uncooked food, while eating the food is not warm, He's taking some dry food, let's say like the mixtures and the popcorns and things like that. He's taking not sufficient quantity of food, muddled food, incompatible food. Incompatible food in Ayurveda is another topic which will take one, but I'll give small example. Like milk and fruit should not go together. It's incompatible. We call it as viruddhana. And people, they take mango milkshake, yeah, mango lassi and whatnot. So different kinds of avocado milkshake. So Ayurveda says a big no. They are not to be consumed. They bring not only infertility, various skin diseases, digestive disorders. There are so many things. So we should not have incompatible food. One more is the common honey with the hot substances. So Ayurveda says honey should never be heated. It should not be mixed with anything hot. And there's this common practice of, heating honey or mixing it with hot water or tea people usually take with a honey into it. Oh, I don't take sugar in the tea, but you're putting honey, and Ayurveda calls it as incompatible food. Over here, it's not what we understand as unprocessed food. In Ayurveda, processed food and unprocessed food means processed food means cooked food where a seasoning is done. Little bit of ghee is there. You splatter some spices like cumin seeds or something, like in Hindi, what they call as tadka dena. So, or you splatter that. You use a blend of turmeric, or you use asafoetida, curry leaves. You use some oil and you season the food. You cook and eat. That's called the food is processed. Unprocessed means you don't add any of this in the food and eat it raw just like that. So here we have to understand processed and unprocessed food in the context of Ayurveda's way of terminology, but not in the way what we understand as the modern aspect. Then another very important aspect is everybody comes home frustrated from the office, or even if they don't have office, probably now, okay, everything is open, but the corona times were like there were maximum divorces I heard in some of the countries because husband and wife couldn't stand their own company for 24 hours, 7 days a week. So shoka, anguish, chinta, something apprehension. You keep on worrying about something, fear, insecurity, bhaya, some trouble you have. So if these emotions in the mind are not managed, yes, then it's leading to the Bijopaghatak Laipya. That is our first kind of impotency. So I'm going to relate it to these four types. So we are going to see these four types in the order. The hereditary congenital defect, that is in the seed, erectile dysfunction, the old age aspect, and the diminished semen aspect. Okay, so we go ahead. Then excess indulgence in women. So yes, overdoing of anything is going to be a problematic thing. Then if you have not balanced your Vata Pitta Kapha properly, there is a problem. Too much of fasting, exertion, or person is not aware only of female interest, then that's also a problem. Undergoing incorrect panchakarma. Okay, panchakarma is good, so go anywhere and do. No, just go to a qualified person and get it done. Deficient semen leads to, again, pallor and weakness. So there are few things like this in the first aspect. I'm just going to go a little faster now. Then so then the second comes is due to the erectile dysfunction. So intake of excess sour, salty food, incompatible food, unsuitable food, drinking excess water also, irregular meals, intake of floury or heavy preparations. Floury means too much flour, batter, or use of yogurt. It's mentioned over excess use of yogurt, milk, and meat of marshy animals. So all this would go to the cause of impotency due to erectile dysfunction. We go ahead. Okay, these are some of the poses that would help in erectile dysfunction. Definitely, yoga is one of a very great solution in solving the infertility. We'll come back onto this aspect. We continue on the third aspect. It's in the old age. So age Ayurveda does classify into the 3 categories, but it is natural that as you would age, there would be a gradual loss of strength, energy. And there's little bit that we can do into this aspect because less of physical exertion, mental exhaustion. So this kind of impotency is very tricky to treat because it's the natural loss or debility of the body, the weakness, poor energy. So not much can be done over here, but we can support with little bit of medicines. And the last but not the least, the deficiency of the dhatu. So again, too much of anger, too much of grief, envy, intoxication, very agitation. These are predominant causes for this, where the tissues in the body, they debilitate faster, and we land up into this particular situation. We go ahead as a general treatment. So again, in a general treatment, the basti, the enema aspect, it's done with milk and ghee combination. Some aphrodisiac herbs are given, and there are some rejuvenating medicines that have been given together. But all this, it is to consider that person's deha bala. That means the strength, the physical strength of the person. Dosha bala. What is the degree of the vata pitta involvement into it? Agni bala. What is the level of fire into it? And bheshaja or lakal. So the time of the medicine administration. So all these factors we will have to consider and treat this particular. Then here we are seeing how in Ayurveda, the basti is being given. So there is a different kind of a nozzle. And over here it's shown in a polythene bag, but there are different kinds of bags where you fill the ingredients and give a specific kind of a treatment. It could be like oleation on the body, giving steam. So one of the very basic needs before you undergo panchakarma therapy, where you have to apply oil on the body and you have to have a steam bath, prepare the body well, then undergo the therapy. We go ahead. So in this technique, we see over here now is yoni vasti, where through the vaginal route, the medication is administered, and predominantly it would be the oil with certain herbs. Last but not the least, we have to manage our diet. In Ayurveda doesn't promote necessarily you have to have a vegetarian food. But when you undergo a panchakarma, when your body is sick, then it is stressing to keep the gut lighter. But otherwise, meat, a soup of like a sheep or a goat is prescribed, and so many other meats of birds and animals have also been prescribed. But that is on a healthy body. In an unhealthy body, it's good to have lighter food, well balanced, cooked food. We don't mix cooked and uncooked food together. There is a place for milk, ghee, rice, wheat, everything in the body. We have these days they say, oh, I'm lactose intolerant or gluten, oh, it's rice, it's too much of carb, I don't think. But there is not to be the extreme of anything. We have to have balance of all. Then there are some aphrodisiac herbs. It's good to have a consultation before using any of these herbs or foods to boost the libido, the interest. So basically, the atmosphere at the end of a tiring day, if the body has to go and still spend energy, nobody is going to be ready. The body has to be fit. The mind has to be alert and lighter. The atmosphere in the house has to be calmer. Then things could work in our favor. Some of our very good poses, but you need to not see the picture and do, but take a guidance. Take a guidance from a proper yoga teacher. And last but not the least, the calmer minds give better solutions. If the mind is always agitated, come what may, the plate in front of you can be the best plate or the best balanced food. If the agitated mind cannot take anything that is good around it. So holding our mind in our control is only the best aspect to deal with this. Let's have a quick recap. There is no option but to follow a healthy lifestyle. What time you sleep, what time you wake up, what time you eat your first morsel of the food, which is your biggest meal of the day. That should be the lunch, it should not be the dinner. Ayurvedic diet concept, it's really what is real food into it. I just touched upon the points very briefly now, but if there are any questions, probably I'll go deeper into it. Yoga is definitely not an exercise format. It is something which calms and it unites yourself to you in a deeper realms. Panchakarma, everybody doesn't do 5 of it. It is need based that the doctor decide, but Panchakarma is one of the key treatments to get done in to boost the fertility. And medicines, there are some metal-based medicines, but which we don't practice over here in Singapore. So at the moment in Singapore, what we practice is all plant-based medicines itself. Again, it is on a need base. Everybody may not get medicine. Sometimes it's mostly a lifestyle change and some therapy, some Panchakarma aspect we get. Last but not the least, I just thank all of you to this divinity of this universe that we are all part of. If we recognize that in each one of us, there would be much better place. Thank you, all of you. I end my little presentation over here. If you have any questions, please, you can type in the chat box. Thank you, Asim, for appreciating that. We'll keep a note of it. Probably Nuffield would get in touch with you. What is Ayurveda view in abortion due to congenital disorder? Again, a repetitive abortion is identifying which dosha is affected. Predominantly, it would be the vata aspect itself. We should again analyze that person, and the person definitely should undergo a panchakarma therapy if the body is permitting. All women may not be healthy enough to undergo a panchakarma treatment. And if the woman is genuinely very, very weak and is not capable to undergo the process of panchakarma, it's very difficult to treat such cases. But in my experience practicing in Singapore itself, I have treated people who are getting habitual, not able to hold the conception. There was even at a 44-year-old, I have got success in treating. They've tried everything and never got success, even all the IVFs and all. But with our little bit of herbs, means there is no side effect. You don't have to do much hormonal beatings around, and the body is not tortured. So it's one of a very softer and very logical way, I think. So thank you, Gabriela, for your question. The answer is yes and no. It depends upon the patient's bul. If the patient is able to undergo panchakarma, then we should be able to succeed. If not, then we'll have to see what is the other option. Sometimes a small yoni pichu means may not be that a yoni basti is directly is given, but a smaller version of it, like a cotton ball of a lemon size, is soaked in a medicated oil or a ghee, and it's placed in the vagina. And then accordingly, the vata is reduced and probably she can come out of it. Yes, that should be a possibility. I see one more question. Okay, it's in the same, yes, so we will note your email address. Any more questions? Let's see. Okay, a general rule for Rasayana before or after intercourse. General rule for Rasayana is your Agni Bala good? Are you able to digest? So the first and foremost, I would say the treatment line is doing Agni Deepan Pachan. That means boosting your capacity to digest. If your Deepan Pachan, if your Agni is very good, then you are able to take a Rasayana. Like Chavan Prash, which people casually take, is actually a Rasayana. And then depending upon, let's say you have a very good digestive system, then we can give Rasayana early in the morning itself. But if it is not, then we mix it with the food. So there are 10 Aushadha Kalas are said. That means when you can administer medicine. So when to administer medicine is depending upon Vata Pitta Kapha, the patient's bala, the digestive capacity, the Agni's angle. So whether it is before food, after food, with every morsel, between the two morsel, in the night, there is so much permutation combination that Ayurveda has said. There are 10 factors we'll have to actually consider. I'll just getting tempted to chant one more shloka because when I chant a shloka, the reference from the 5,000-year-old comes, which authenticates the answer. So what do you analyze in a person? Dusham desham balam kalam analam prakritim vayaha sattvam satvim tatha aharam. So these are 10 factors you see in a patient. Dushyam, what are the problematic areas? Desham, what is the habitat? Balam, what is the bala of the patient? What is the bala of the disease? Dushyam, Desham, Balam, Kalam, what is the time frame when it has happened? What is the time it has happened? What duration? Balam, Kalam, Analam. Analam is fire, Anal. Anal is fire, Anil is Vayu. Anal is fire. What is the digestive capacity? Sattva, what is the strength of that person's mind? Satmya, what that person naturally can digest. Like some things may not be healthy, but the person digests. Like if you go to North India, the Ayurveda physician, the Vaidya will say, don't have idli. They are floury substance, they are fermented. You come down to South and the Vaidya will say, have idli, they are steamed and they are lighter. So it's a Satmya issue where you are. So nothing is permanently good, nothing is permanently wrong. And tatha aharam. Ahara is like, one vast ocean in Ayurveda, which I would really like to talk and keep on talking about it. But Gabriela, to your answer, like there are so many factors that the Vaidya has to see, the Ayurveda doctor has to see before giving the solution. Okay. Generally, how long to treat Ayurveda? It is all again individual thing. The 44-year-old, I got success in about 3 months only. So, but because probably her body was able to take that. Then there was this young first timer pregnancy. She couldn't hold a pregnancy, a teenager, 19, 20-year-old. But during the second time with certain medicines itself, without undergoing panchakarma, that body could. So again, as I said, these factors, depending upon that patient's strength and the disease strength, we can get success, Carol. I hope I've answered that question as well. Any more queries you have? Okay, so I think I've answered all the questions in the answer box. Okay, in the question. Asim Rehan's question is still there. Okay, yes. So probably the organizers would get in touch with you, Asim Rehan. Okay, I see one more coming up. It's my pleasure. Thank you. So shall we end this session with a small prayer, gratitude to universe to empower me and enable me to talk my little ramblings on this vast topic, which I try to concise, and there is so much more in each of these factors that I have said. Thank you to all of you. Over to you, Ken.
Thank you, Dr. Varsha. Okay, for enlightening us on this topic. Okay, without further questions, I'd like to end the session. I'd like to thank all attendees for attending this webinar as well. Thank you very much. Have a good evening.